the light on. You're killing me. You can always tell when I'm at home my wife's helping me make videos. Thank you, dear, for supporting me. I'm going to go ahead and just add a little video to add on to a post that I've done talking about the dominant side, low shoulder, a common imbalance that I noticed, and I've got a young athlete that happens to be related to me, but he's also a minor, and his mother or father aren't here to sign a waiver, so he's in disguise, and we won't use his name, but I'll talk a little bit about that. He's going to help me out, and as it turns out, he's set up to be disguised, but he has exactly what we're talking about, so I'm going to point that out. So, Commander Cody, if you could come over here. Beautiful. So, Commander Cody, relax the shoulders. So, if you can look at the shoulders and look at the thumbs, there's a difference in height of the shoulders. If you notice, this right shoulder is lower and it's tilted anteriorly more. So, Commander Cody, turn 180 degrees the other way. What I'm going to have you do is tilt the mask slightly forward, but let's lift the left arm up nice and slowly, and then put it back down. And do that again. What I want you to do is I want you to watch the lines right here on the shirt. Go ahead and do it again. And go back down. So there's a little bit of upward rotation of the scapula, but there's not early or excessive elevation. There's not extra tonicity. But right away, tough to see from there, but you've got some hypertonicity. The scapula is not aligned correctly. So lift this arm up slowly there, Commander Cody. You can see there's excessive movement to scapula early on. And go back down. Lift it back up again. Go back down. The scapula is not moving like it should. It's jammed up. There's hypertonicity through here to the levator scapula. Show the left side again, please, there, Commander. Then go back down. And this side's a subtle difference. Probably easier to see without the helmet and mask, but come all the way back up. So when we see this, what we're looking at is overactivity in a few muscles. So using a single tennis ball, this is two taped together, to do some mild fascia release through the levator scapula, through the rhomboids. Levator scapula and the rhomboids are going to cause some downward rotation of the scapula. Let's go ahead and turn towards the side, Commander Cody, just like this. Then using a tennis ball in through this area, through pectoralis minor as well, which can downwardly rotate and protract the scapula. This a lot of times you'll see from people sleeping on their side, being a righty, being right-hand dominant in an athletic, especially unilateral sport like tennis, etc. So we can do mild fascia release techniques to soften these areas. Commander Cody, that's it. I'll have you step out of the frame. We can always also use something like the Theracane. I've had this probably since like 1998. It's held up very well. But just to find any trigger points or sore spots that you might have through the levator scapula, you can do the exact same thing on the pec minor. It's tougher to do with this, but it gives you a little bit of extra leverage. Lots of toys and things that you can use. Even basic lengthening techniques for levator scapula. Locking one arm in, retract the scapula, turn the cervical spine 45 degrees, flex, add some basic overpressure. From the back, looks like this. Trying to feel a pull along levator scapula. Pec minor stretches where you have the humerus at about 120 degrees to emphasize that lengthening technique through there. And then once you get to the strengthening or activation techniques, one of the best exercises for this is actually usually called the core exercise, so either bird dog or quadruped exercise, which I'll demonstrate here on the floor. I'll just kind of pop down where I'm going to end up on all fours. Chin's in, shoulder and hips are in alignment, abs are engaged. I'm going to come up at a 45-degree angle. Back down slowly. This exercise, this is where the magic happens on the deceleration, very slow and controlled. Plant, reset, transfer your weight, come up to the other side. Slow and controlled, decelerate, plant, reset, come up to the other side. It's been a staple exercise for core training for years. Engage the abdominals, get that closed chain effect for that weak serratus anterior that you're going to get. You're also going to get some nice lower trapezius and upper trapezius work at especially the lower trap as you're coming up at that 45-degree angle. So when you see that dominant shoulder on the low side, you have someone sit down, you usually see that early and excessive elevation of the scapula. You've got some hypertonicity there. You've got an anterior carriage of the scapula and the head of the humerus. Mild fascia release or soft tissue work, pec minor, levator scapula, lengthening techniques on those areas. Then you can perform some activation techniques. As I've mentioned, you can isolate those. The list is really endless. I go over a bunch of those in my video at athleticshoulder.com. But this concept, if you can identify this and begin the corrective process, can save you a lot of headaches, literally and figuratively, as well as some shoulder pain, elbow pain, and dysfunction throughout the rest of the body. Thanks so much for watching. I'm Eric Beard. Have a great night.